I'm here with Cindy and Fred. Cindy is a patient of Dr. Graywall's. She was diagnosed with early onset Alzheimer's in April of 2022. Um, can you please tell me what brought you to see Dr. Graywall?
Absolutely. In 2021 and the early part of 2022, we had noticed significant degradation in Cindy's memory. Enough that we wanted to make sure that we came in to see a specialist to find out if there was anything particularly wrong. And during that time frame, we had not only the normal psychiatric tests, but also they checked the spinal fluid and found markers for Alzheimer's. And we were lucky because we found out early that she had Alzheimer's. So one of the things that we were very interested in was some of the new procedures that were coming out at that time for Alzheimer's. And although we missed the first trial, which was a different drug than the one that she's on now, Dr. Graywall was able to get her into the drug program for a new drug called Leqembi. And that started about 9 months ago in the fall of 2023. And she had to go through a short testing period, needed to get an MRI. There needed to be a check on the markers in her blood to make sure that she would not be susceptible to the different kinds of side effects that could occur. And then after we took a look at everything that was going on with her, Dr. Graywall basically asked us, now do you think that this is something you would be interested in? We jumped at the chance, and I did not try to influence my wife in any way, but she felt very strongly that it would be better to try to do something rather than just allow the degradation to continue. So we got into the program. In the program, she gets an infusion every 2 weeks. It takes about an hour. It's not particularly painful. The first thing they do is give her some Benadryl so she's sleepy. Then they give her the drug, and it has very few, in her case, very few side effects. She's not particularly tired. She doesn't feel any pain, anything of that nature when the drug goes over. As I understand the drug, it eats away at the amyloids that are on the brain that are associated with Alzheimer's. And that is what allows her to at least maintain stability. And we think, in our opinion, that over the last 20 infusions or so, she has actually improved, which is very unusual from what I understand. Dr. Graywall has been absolutely wonderful during all of this. He brings us in on a routine basis. I keep notes at home, trying to make sure that I understand whether or not there's any degradation or not. But he listens to us. He understands our concerns. He follows up on everything that we ask him about. He keeps his eye out for other potential treatments that may be coming up in the future. There are several drugs right now, different kinds of drugs that are in the pipeline for approval, and it has to be approved both by the FHA and the FDA, the Food and Drug Administration, and by the CDC in order for them to be paid for. In the case of Leqembi, we pay about $500 a month for the treatments that Cindy gets. Well worth our money. Cannot imagine our life would be like had the degradation continued. But right now, Cindy's able to do pretty much everything she was able to do back in the early days in 2022. We go on cruises. We're able to structure our every 2 week infusion. So in other words, we could, if we can't make a particular date, so it's exactly 2 weeks, we just stretch it out a little bit farther. That helps with, it's not a problem in the drug program, and we found it to be very effective.
Very nice. And what would you tell your friends or family about Dr. Gray?
I think the important part for, well, first off, I think the important part for all doctors is that they keep up to date on what's going on. Dr. Graywell does that. Um, and so that was very important to us. We had actually also gone to the Rosecamp Institute and had several other feelers out to different um, places where they're doing studies so that we could kind of judge what was coming down the pipe. Dr. Graywell took that burden off from me. I trust him. That's one of the reasons why I have particularly liked the fact that he's been Cindy's doctor. He's got a great bedside manner, I guess you would say. He cares about his patients. He knows his patients very well. So from my perspective, it's been an absolutely wonderful experience. And I would recommend that anybody that is going through this, take your time, look at the options, talk to the professionals, and you're going to have a journey as this goes on. I mean, we've just started our journey for the last 2 years. But in our case, we've had both my mother and Cindy's mother both died of Alzheimer's. And we saw what happened to them over the period of time. And I know that in both cases, had this drug been available to them, this treatment, this type of treatment, been available to them, they would have had a far better quality of life for years than they did. Cindy's mother just passed 2 years ago. My mother passed in 1997, and she was very young. She was only 77 years old when she died. So do your homework, talk to people, and try to make sure that you find the right doctor, even if it isn't Dr. Greenwald, although I would recommend him highly.
Nice. Thank you, Cindy and Fred.